Hello everyone! Let us begin this training session for RAs with the APU Health Clinic. Today we will talk about how to prevent infectious diseases and how to deal with sick or injured residents. Next, we are going to talk about preventing infections. Our discussion will cover infectious routes, how to protect yourself and others from spreading infections, and things to do when you are feeling unwell. An infection is a disease that occurs when a disease-triggering pathogen enters the body, multiplies, and causes symptoms like fever or diarrhea. To protect yourself from infections, it is important to prevent pathogens from entering your body. To help you do that, we will first learn the routes a pathogen can take to get into the body. Firstly, an airborne infection is where you become infected by inhaling particles dispersed in the air when someone coughs or sneezes. Next, a droplet infection where pathogens in droplets are dispersed when someone coughs or sneezes come in direct contact with your mucous membrane in your nose or mouth. Lastly, there are contagions where you become infected when you directly or indirectly contact the pathogen. When a pathogen enters the body, you may or may not develop symptoms. The strength of the pathogen to infect you and your body's ability to fight the pathogen determine if you will develop an infectious disease. Next, we will take a closer look at what you should do to prevent infection. The first thing you can do to prevent infection is to build up enough immunity to overcome pathogens. The immune system is a protective system that expels bacteria, viruses, and other harmful invaders from your body to keep you healthy. If your immune system weakens, you become more susceptible to all kinds of diseases. People with strong immune systems may only have mild symptoms even when they get infected. The key to a properly functioning immune system is a well-balanced autonomic nervous system. The autonomic nervous system is divided into sympathetic nerves and parasympathetic nerves. Sympathetic nerves dominate mostly in the daytime while you are active and boost your body's overall activity level. Parasympathetic nerves dominate mostly at night when you are relaxed and restore your body so that your immune system functions properly. You have to maintain a good balance in your autonomic nervous system to keep your immune system working properly. Some things that affect your autonomic nervous system are an imbalanced diet, drop in quality of sleep, irregular lifestyle, stress, and changes accompanying transition between seasons. Because of this, it is important to pay attention to these factors that affect your autonomic nervous system daily to maintain a well-balanced autonomic nervous system and keep your immune system strong. Let's take a closer look at what you can do to boost your immunity. The first is your diet. Do you ever try to make a meal out of just snacks? The nutrients in snacks are mostly sugar and fat, so you cannot get the nutrition your body needs from snacks. Our body is made up of the food that we eat. It is important to eat 3 meals a day with a good balance of various components including carbohydrates, vegetables, and proteins, as this diagram shows. To get good quality sleep, you should take a leisurely bath in water that feels warm but not too hot, around 40 degrees Celsius, about an hour or two before you plan to go to sleep. There are 2 main reasons why. The first is that it has relaxing effects that boost your parasympathetic nervous system and make it easier to fall asleep. The second is that raising your core body temperature can induce sleepiness when your body temperature drops after bath. The way our body works is that we feel sleepy when our core body temperature drops. Be careful though, because a 40 degrees Celsius or hotter bath right before bed can actually increase sympathetic nervous activity. Next, it is important to induce exposure to light from cell phones and computers before bed. The light emitted from smartphones, computers, and tablets trick your brain into thinking it is daytime, causing arousal in your brain, which can lead to sleep disturbances like light sleep. Be especially mindful of using smartphones that are held close to your face before bed. Lastly, exercising in the evening or at night, about 3 hours before bed, also improves sleep. The key is to temporarily increase your brain temperature by exercising a few hours before bed. If you do this, the amount that your brain temperature decreases before bed is greater compared to when you do not exercise. Sleep comes more easily when your brain temperature falls so that you can get better sleep as a result. Exercising right before bed will make you more active, so it is not advised.
Next, we will talk about keeping good daily rhythms. Waking up, going to bed, and having meals at regular times creates good daily rhythms. Keeps your autonomic nervous system from becoming unbalanced and keeps your immune system working. Humans have internal rhythms with a roughly 24-hour cycle, and a system that makes you active in the day and puts you in rest mode at night. The factor that has the strongest influence and synchronizes your internal clock is light. If you stay up late in a bright environment for a long time, or sleep in until late and delay exposure of your body to sunlight, your body becomes unable to synchronize its clock, and your internal rhythms becomes disrupted, potentially disrupting the balance of your autonomic nervous system. Keep your internal rhythms working smoothly by exposing yourself to morning sunlight soon after waking up. Light resets the internal clock in your brain. Also, eating breakfast signals to your various organs that it is morning and keeps your internal rhythms working smoothly. This can also improve the quality of your nighttime sleep. Next, to keep stress from building up, try to release it in your daily life by giving yourself time to talk and do leisure activities, or stretching, or exercising to keep yourself feeling calm. Also, smiling and laughing activates your parasympathetic nervous system. Laughing joyfully also activates natural killer cells, NK cells, that are a type of immune cell in your body and might boost your immunity. Next is exercise. Moving your body improves your blood circulation, increases your body temperature and metabolism, and boosts your immunity. It is also linked to heart and lung function and maintenance of physical strength. Exercising also lengthens the amount of time when your sympathetic nervous system is dominant, making you more likely to have positive feelings and excrete stress-relieving hormones. Try walking just 10 minutes more than usual each day. Increase your physical activity level, and develop an exercise routine. For example, try using the stairs when possible, walking more quickly, opening your stride, and cleaning often. A good idea is to use your smartphone to keep track of your daily steps. 8,000 steps a day is ideal. You can increase your count by 1,000 steps just by walking 10 extra minutes a day. Although, there are currently restrictions on exercising in campus facilities to control the spread of infections. You can do other types of exercise like stretching, weight training, and yoga by yourself in your room. There are many videos in YouTube and other platforms that you can use. So try adding exercise you can do alone in your room to your routine. The second thing you should do to protect yourself from infection is to prevent pathogens from entering your body. We discussed it earlier how pathogens have 3 routes for entering the body. We know that many infections like cold and the flu that cause disease are introduced to your body through your hands. There are bacteria and viruses on places like doorknobs that are all around us. When you touch those places with your hand and then touch your eyes, nose, or mouth, or eat something, the bacteria and viruses get into your body. To prevent bacteria and viruses from invading your body, it is important to gargle and wash off any bacteria and viruses from your hands. Also, not touching your eyes, nose, mouth, and other mucous membranes with your hands that could be covered in bacteria or viruses will prevent bacteria and viruses from invading your body. It is also important that you do not touch someone who is ill. Next, here are some specific things you can do to prevent infection. Hand washing and mask are important infection control measures. When do you wash your hands? The best times to wash your hands are before preparing food or eating and after coming home, using the bathroom, coughing, sneezing, and blowing your nose. Other good times to wash your hands are after touching handrails, doorknobs, other places people often touch, and before and after touching your eyes, nose, and mouth. Next, we will talk about hand sanitizers. In general, it is important to wash your hands with soap and running water, but when that is impossible, hand sanitizers is effective. It is even more effective to use it after washing your hands with soap and running water. It does not have cleaning properties, so it cannot remove dirt or germs from your hands. So, if your hands are dirty, you must wash them.
Next, we will talk about face masks. The primary function of mask is to prevent the dispersion of airborne droplets. Wearing a mask if you're infected prevents you from infecting others. Masks can prevent viruses from entering the body to some extent. Now, when do you need to wear a mask? First, know that you cannot easily determine if you're infected, so everyone must act as if they're infected. If you have a fever, coughing, sneezing, or other symptoms, make sure you wear a mask to prevent your own droplets from dispersing to someone else. Also, if you're talking to someone outside or indoors and cannot maintain an adequate social distance, be sure to wear a mask, even if you do not have symptoms, to keep your droplets from dispersing. Even if you're making an effort to wear a mask, it means nothing if you're not wearing it correctly. Make sure your nose and mouth are fully covered. Also, touching the surface of the mask can contaminate it with bacteria and viruses and increase your risk of infection. So, do not touch the surface of the mask. Make sure you wash your hands after removing your mask. When throwing a used mask away, hold it by the ear straps without touching the surface of the mask. Put it in a plastic bag and tie it shut, or put it in a lidded garbage can. After discarding it, wash your hands. Next, we will talk about what you should do when you're feeling ill. When you're not feeling well, do not push yourself. First, you need to rest. Get plenty of sleep and nutrition and drink fluids to prevent dehydration. Stay in your room as much as possible so that you do not pass anything on to anyone else. If you must leave your room, make sure you wear a mask. And also, enter your body temperature, symptoms, details of consultation properly on the health check monitoring survey. If you're not feeling well on weekdays, email APU Health Clinic by 5:30 p.m. If you're not feeling well on weekends, holidays, and at night, call the security office from your room telephone. Anyone can get infected. The daily health check monitoring survey helps the university understand changes to your health conditions and reduce the risk of mass infection. If you feel unwell, please inform the university immediately. This step is not only for your own benefit, but also to protect those around you. We ask for everyone's cooperation. If you see some residents who are feeling unwell, please tell them to respond to the survey properly. Contact to APU Health Clinic or Security Office by themselves. Finally, remember that anyone can be infected, especially with new infectious diseases. There are still many things that are unclear medically. It is terrifying and causes anxiety, so we are more ready to believe unconfirmed information on social media and the internet. Do not listen to unconfirmed information. Get accurate information provided by official government and other public organizations and think and act calmly. Also, if you see someone coughing, do not automatically assume they are infected and spread rumors about them when they are not around or write their personal information on social media. Even if you find out that someone is infected, you should never write that they are infected on social media. It is nearly impossible to completely remove information posted online, including social media, once it starts to spread. Do not post or share personal information or unconfirmed information online. As RAs, if you find out that a resident has done this, please give them a warning and tell them they must not do it again.
Next, I will talk about how to handle sick or ill residents. AP House is a place where people with varying values and differences in their culture and environment where they were brought up live communally. In such a living situation, some students will experience the worsening of pre existing conditions. Others may become unwell even without having such a condition. There have been cases of students having an epileptic seizure, hyperventilating, or suddenly collapsing. No one can foresee who will have such an experience. That is why students must keep themselves in a good physical health on their own. Today, we would like to cultivate your familiarity with the general process to handle someone experiencing sickness or injury. We will discuss three scenarios. The three scenarios are discovering someone who has collapsed in AP House, handling a student experiencing an epileptic seizure or hyperventilating, and handling sick or injured residents on the scene. Firstly, we will discuss situations where you discover someone who has collapsed. Before you approach them, there are certain things you should do. Should you see someone suddenly keel over or discover someone who has collapsed, the first thing you should do is to check and see whether or not the surrounding conditions are safe. Next, you should check whether the person who has collapsed has lost a lot of blood. The situations may require you to check certain aspects of safety. For example, if the person collapsed in the kitchen, you should check whether the stove have been left on. Likewise, in other locations, you should check whether something is in danger from falling from above or whether the person is at risk of falling down the stairs. Ensuring your safety takes precedence, even before helping the person who has collapsed. In cases where you may be exposed to physical harm, it is sometimes better not to approach that person, and instead, wait for the person you called for help, be it the security officer or a university staff member, to arrive on the scene. After you have finished checking the safety of the surrounding conditions, check to see if the person who has collapsed is responsive. Tap their shoulders lightly as you call out to them. Are you alright? Make sure to tap both shoulders when you do, as they may not feel anything on one side due to numbness. Do not shake the person with excessive force. Should their neck be broken, it is better not to move their head. If they open their eyes or otherwise move with some form of intent, you can interpret that as a response. If they are not responding or are not confident in your interpretation, assume that the person's heart may have stopped. Your first order of action should then be to call for help and notify the security officer. If you discover somebody exhibiting no response, the standard process for saving their life is to call for an ambulance as fast as humanly possible and use an AED. At AP House, we ask that you first call for help, then ask someone who arrived at the scene to notify the security officer. When calling out for help, shout out, "Someone, please help. This person has collapsed," in a loud voice. You need to remain by the person's side so you can monitor them. If someone is already right next to you, or arrive to help right away, ask them to notify the security officer. Be very specific when you are requesting them to do so, saying, will you please contact the security officer? When multiple people gather at the scene and there is no clarity on who is doing what, people might mistakenly think that someone else will take care of it. If no one comes for help, even after shouting in a loud voice, notify the security officer on your own without leaving the scene. When notifying the security officer, remain calm and call one of the numbers shown on this slide. Your explanations need to be as precise as possible. Make sure to state whether the person responded when you call out to them or if they are bleeding. Also, if possible, please relay information such as the person suddenly keeled over, started convulsing, could not move, or was pale. Tell the security officer your name as well. Next, as you wait for the security officer to arrive, first see if the person who has collapsed is breathing. You can tell by noting whether their chest and stomach are moving up and down with each breath as they normally would. If the person who has collapsed is unconscious but is breathing, place them on their sides as shown in the picture and wait for the security officer to arrive. When people are unconscious, the muscles in their tongues become loose. The weight of the tongue then causes it to fall towards the back of the throat. It should also be noted that people who have collapsed may vomit. If these things cause air passage blockage, oxygen will become unable to enter the person's body, potentially causing damage to the brain. That is why it is necessary to turn the person's body sideways and keep their air passage open. To place someone on their sides, first stretch their hand on your side out perpendicularly, as shown in the picture. Next, while holding their waist and shoulders, gently pull them up towards you and place their hand up top below their face. While propping up the person's body using your thighs, turn their chin outwards and place it on the palm of their hand. Pull their knee facing upwards towards their body until it reaches an angle of about 90 degrees, making sure that the person doesn't roll backward. As you wait for the security officer to arrive, verify information about the person. Firstly, confirm their room number so the security officer can identify who they are. If they are conscious, ask them if they have any pre-existing conditions, are currently taking any medications, have had any serious illnesses, or have any allergies. Once the security officer arrives, report the information that you verified to them and follow their instructions. Let's go over the process when discovering someone who has collapsed one last time. If you see someone who's collapsed, check and ensure the surroundings are safe before approaching them. Next, check if they are conscious. If they are not, call for help right away and notify the security officer. Check if they are breathing. If they are unconscious but still breathing, place them on their sides so that the air passage isn't blocked. As you wait for the security officer to arrive, verify information about the person who collapsed and report it to the security officer.
Now, I will explain the action to take when you find somebody experiencing an epileptic seizure or hyperventilation. The first thing you should do is call the security officer. The security officer decides whether it is necessary to call an ambulance. RAs are asked to handle the situation until the security officer arrives on the scene. First, let us cover epileptic seizures. When someone has an epileptic seizure, their body convulses in the manner shown in this illustration. Epilepsy is an illness of the brain. Our brains carry out a repeated balance cycle of switching our nerve cells on and off. Through this cycle, they communicate correct information and give orders to move the body in a certain way. With epilepsy, many of the nerve cells in the cerebrums are switched on all at once, which causes that balance cycle to break down and triggers a number of symptoms. Let's take a detailed look at how to handle someone experiencing an epileptic seizure. Epileptic seizures generally subside in 1 to 2 minutes. The very first thing you should do before taking an action is to calm down. Remove any hazardous objects from the surrounding area and keep them away from other dangerous things or locations. Then, use clothing, a bag, or something similar to protect the person's head. Key information in treating epilepsy is the duration of a seizure and what kind of seizure took place. When someone experiencing a seizure, it is not uncommon for them to partially or even fully lose consciousness. This makes it difficult for them to know just what their symptoms during the seizure were. That's why people in the vicinity need to monitor roughly how many minutes the seizure lasted and what kind of seizure took place after they arrive on the scene and report that information to the security officer. Once the seizure subsides, check whether the person is breathing or is conscious. Also, some people vomit during or after having a seizure, so it is best to put them on their sides to prevent vomit from becoming stuck in their throat. Lastly, we will go over what you must avoid doing while someone is experiencing an epileptic seizure. They are covering their mouth with a towel or placing chopsticks or something else into their mouth. Doing so may cause the object to get stuck in their throat or injure their oral cavity. Calling out their names in a loud voice, holding down the person, or shaking them while they are convulsing. Stimulating them in such a fashion may cause a seizure that would normally stop to continue. Now we will move to the topic of hyperventilation syndrome, which results in fits of breathing as illustrated. Hyperventilation syndrome occurs as a result of mental factors such as nervousness, anxiety, or excitement. Breath becomes short and rapid, causing carbon dioxide levels in the body to drop and creating anomalies with the muscles and nerves. Examples of respiratory symptoms of hyperventilation syndrome include hard, rapid breathing and difficulty breathing accompanied by a sense of choking. Neurological symptoms include numbness in the tips of the fingers and toes and around the mouth, and dizziness, nausea, and cold sweats. Cardiovascular symptoms include palpitations and a racing pulse. In dealing with hyperventilation syndrome, it is important to calm the hyperventilation person down and prepare a quiet environment for them. When hyperventilation is prolonged or worsens, convulsions and loss of consciousness may occur. However, the person will not stop breathing. Keep yourselves calm as you handle them. It is essential as that you tell the person hyperventilating to exhale longer. Short, quick breath make it more difficult to breathe and cause numbness in the hands and feet, making the situation worse. Tell the person to be mindful to exhale slowly. When doing so, have them pucker their mouth and pat them slowly and gently on the back to help them establish their breathing rhythm. This will make it easier for them to breathe slowly. Afterwards, tell the person hyperventilating that they are all right to put them at ease. Convey to them that they are properly breathing in oxygen and remain by their side. When a person hyperventilates, they may aware that it will happen again. That feeling may trigger them to hyperventilate again. RAs are asked to regularly look out for residents who have episodes of hyperventilations and check up on them so that their anxiety doesn't build up. Also, take note of the situation of any students who have gathered in the surrounding area. When people collapse or are sick, and other people gather in the surrounding area, they often become anxious or confused. In such instances, we would like RAs to remain calm, then prepare the surrounding environments for the sick or injured residents, and handle any students who have gathered in the vicinity. Start by securing the safety of the sick or injured residents together with your safety. Next, if possible, create a quiet environment. Please handle any students who have gathered in the vicinity in the following fashion. Ask students who are being nosy to leave the scene. Also, if any students are taking videos or photos, ask them to stop and erase any videos or photos that they took. Make it a point to safeguard the privacy of the sick or injured resident. In closing, as an RA, make sure to keep yourself healthy and consider your health to be a top priority. If you become injured or fall ill, you will become unable to perform the duties of an RA. Please don't try to solve problems by yourself. The health clinic is on campus. If you have any health-related concern, please call on us at any time to give you a hand. Thank you very much.